Hi, welcome to this week's video blog. This is Chad Clark, where we represent Physical Therapy Connections here in Pueblo, Colorado. We can be reached at the www.pt-connections.com. And I thought this week would be very good to talk about knee pain. That's a very popular thing that we see here. It's about a third of our patient population, whether they're coming in with true joint pain, a meniscus problem, maybe they tore their ACL, but they don't really want surgery because they're not going to get back into basketball or skiing, and they just want to get better at their knee. So what we find, and why we always tell people we take a whole body approach, and the knee's a great example, is you have your hip joint above the knee and you have your ankle joint below the knee. And usually the knee problems are a result of the ankle not doing its thing and the hip not doing its thing. Relatively speaking, the ankle and hip should be your more mobile joints, and the knee should be relatively stable. It does have give to it, but compared to the ankle and hip, the joints above and below it, it should be more stable. So one really quick thing you can do, and this overlaps with some of the things we have done before with people's balance or even hip problems, is you would want to do a quick test, standing on one leg, reach forward, and see how stable you can stay with your knee, but let your hip and ankle move. And then you would always want to compare side to side, and if you find there's a difference, what we've noticed in here is, let's say one side is really good, just nice and solid, you don't have to touch down, it's very smooth, but the other side's very wobbly and you don't have stability on the right knee. You have two options. You can train that right knee directly. If it doesn't have pain, that's probably a good idea. And usually we find if you do about 5 repetitions, at least one set of 5 repetitions, up to 5 sets of 5, and this could be spread out throughout the day, on the side that's worse but doesn't have pain. If it has a lot of pain and it just feels very unstable and you feel like you're going to give at any moment, train the good side. As strange as that may seem, we have taken a lot of courses and applied it in here with probably thousands of people, that when you train the good side, it's already good, it doesn't have pain, it's stable, then immediately recheck the what's called the bad side or your painful side. It will get better. So that's a quick thing that you could do that's kind of a self-treatment, as well as just trying to figure out where your problem areas are. Like always, if you have any questions, definitely come by, call, or contact us, and we'd like to hear what you find with your knee. Thanks.